Okay, good day everyone. So let's continue module 8 of chapter 41, Caring for Infants and Their Parents. So basically, I'll be discussing first the birth parents and newborns. So usually for birth parents and newborns, there is a short hospital stays, usually like 2 to 3 days. There's no complications. Sometimes too, if they're really like okay after a day, after 24 hours, they're already sent back home, right? So home care reasons include maybe if there's complications, there might be like multiple births, like twin abilities, or maybe infant special needs and adjustment challenges. So that's the reason why we might get a request for a home care setup. So meaning there might be a nurse that will visit in their home or caregiver to check the mother and the newborn, right? So that might be a possibility. So caring for for new birth parents, a postpartum period lasts for 6 weeks, guys. So it's actually lasting for 6 weeks. Need to make sure that the mother is okay, both physically, emotionally, and mentally. Your task as a support worker, if you will be caring for them, make sure take care for both parent and the newborn. Assist with children like the way they still like to bring to for meal time or maybe like even for like cleaning the baby if it's allowed to bathe the baby or even the mother for ADLs, you are always assisting them for that, right? So for pregnant for sorry for newly delivered mother and a newborn, your client are always the two, right? So the mother and the newborn. So the postpartum physical changes. So just to give you an idea, I know for the mothers, maybe you're a little bit familiar with this one. So lochia, those are those are the discharges. So usually it's after the birth. So those are like thickened one that coming out from the mother's vagina. So the lochia robia, it's color red. It's first to 5 days after birth. Lochia serosa, it's the pinkish brown. It will last up to 10 days after birth. Lochia alba, it's the whitish one. It's coming out from the mother's vagina. It will last for 2 to 6 weeks, right? So foul odor, if you can smell, like if you are changing the mother and under their underwear or like diapers or whatnot, if you think that it's like kind of like a different color, not mentioned from this I just mentioned, and then it has a foul odor, then make sure then maybe there might be a potential infection. So report immediately to your supervisor so that it can be assessed further, right? So perineal care. So of course, perineal care, remember it's changing the private area of the mother. So change the sanitary pads frequently, at least depends on how much the discharges is coming out. In with the squirt bottle. So like make sure that you wipe the mother's private. Make sure it's always the proper wiping technique. It's always front to back. Do not go back and forth. It should always be front to back to avoid UTI or urinary tract infection, right? And make sure hand care after, before and after, and eliminate everything, all the discharges, and put in the garbage, like post garbage, right? So make sure perineal care. I think I have a video that I showed you how to do perineal care. If I'm not mistaken, it's in chapter 2 or 4. Sorry, not chapter, module 2 or 4. So you can always double check it there. It's the perineal care video. So that will guide you on how to do perineal care properly. Next, episiotomy or episiotomy care. We say episiotomy care, that's the incision that has been made to expand the vaginal or the vaginal opening so that the baby can come out, right? So that is the incision made to increase the size of the vaginal opening. So for the episiotomy care, usually after that, doctor or the midwife or whoever are responsible for it for the delivery, they will do incision. After the incision, they will do suturing to close the extra opening that they cut, right? So there might be some sitz baths for comfort and hygiene. So after that, the mother might be asked for sit bath for like it's an intervention to give comfort and hygiene for the perineal area. Of course, aside from that, when you're cleaning the mother, when you're doing perineal care, it's part of the episiotomy care that we need make sure to check the wound area. that is it's not separating, it's intact, and there's no foul odor and infection, like there is no coming, like if you can see unusuality, like maybe like a lot of pus or anything like that, and it's really foul odor, then that means there might be a sign of infection. Make sure report immediately for any discharges and any okay. We also have what we call the cesarean section if the mother cannot give a normal delivery. So they might gonna be endorsed into a cesarean section, or and then we will have a cesarean section care, right? So surgical abdominal delivery, that means there is an incision in the abdomen part of the mother, and the baby will come out from there. It might require longer recovery. Sometimes they might stay longer in the hospital because of it is considered a major surgery, right? So we need to monitor the incision site when we're doing our ADLs. Make sure to report immediately to your supervisor if there's heavy bleeding, if the incision site is a little bit foul, providing foul odor, and it doesn't look good. So you need to make sure that you report that immediately. Okay, so basically your part here is to give observation, to provide hygiene, anything like that. So you don't need to do suture, you don't need to do dressing, etc., unless you are trained the dressing. You are trained to do the dressing. Okay, that's a different story. Next is the breast care and lactation. So when the mother is giving milk, the newborn, it's usually after day 3, or maybe during the day 3 after delivery. Make sure that you will teach the mother, will encourage the mother to clean the nipple first before and after the feeding. So also, if you see that the nipples are engorging, that means can actually cause swelling and pain for the mother. But then again, you need to also encourage the mother to do alternate feeding from both left and right breast. Should always be alternate, not only on one side, because the nipple will engorge, because the baby might gonna bite or something like that, suck it the nipple, so it might gonna get into swelling and pain. Make sure that encourage the mother to always clean the nipples, the area of the breast, so that to avoid any complications, right? So that's very important. And make sure that it's always, ideally it's always like a sitting position. That's always ideal. It's in a sitting position, or a Fowler's position. So what are the breastfeeding complications? So of course, plug ducts cause tender lumps. So if there's like tender lumps on the breast of the mother, then milk might have a hard time to come out from the nipples. Cystitis, or is painful breast infection. So that is also considered a complication. So it's always ideal to let the milk out from the mother's breast. But sometimes there are like really mothers who are difficult in producing milk, so encourage them to drink green leafy vegetables if allowed, and encourage them to drink more fluids. And if ever there's something happens, or there might be some complications, of course report that immediately to your supervisor. So during the postpartum period, there might be some emotional changes too because of the delivery, especially if it's a new mother. There might be mood swings. There might be changes in the personality, so you need to observe that. We should not consider should always report immediately if there might be any changes. We don't want to lead to postpartum depression. It's always good to encourage the mom to have a conversation. Always greet the mother. Always initiate conversation as well, right? It might be caused, the emotional changes might be caused by hormones, fatigue, and stress. So there might be some postpartum mood disorders. As what I mentioned, the postpartum blues. It can be mild to short term. Postpartum depressions that is already needs requiring care, and postpartum psychosis needs, that means that's emergency. It needs a like more serious treatment. So if it's already have some postpartum blues, which is the beginning or the onset, so make sure that you already help them, encourage them, and give them positive conversation, right? Because we don't want them to lead into depression. Okay? In case depression comes in, you need to report immediately. Even the postpartum blues, you need to report that immediately to your supervisor. So safety is the priority in caring for infants, because infants cannot talk, they cannot support themselves, they cannot protect themselves. Please practice proper hand hygiene before touching the infant. Make sure that you always had the hand hygiene. You don't want the bacteria coming into the baby. and then make sure you read the care plan and follow what's in the care plan. Okay, that's very important for handling the infants. So for holding and handling infants, make sure that you are gentle, provide smooth movement, don't be rough, support the head and the entire body. So you like cuddle, and make sure avoid sudden or jerking motion. Do not jerk your baby, or do not, like, shake your baby, because they might have like a complication like baby shaken syndrome, right? So that's a big no-no. Comforting and swaddling, of course you need to ask permission from the mother or from the parents, like, can I swaddle the baby, can I carry the baby, anything like that. Even you're a PSW, you need to always make sure to ask permission. Avoid overheating. You should not overheat the baby. Make sure it's temperature, proper room temperature. So when the baby is crying, always remember that is a form of communication. They might be hungry, their underwear or diaper might be soaked, they might gonna want to be carried away, or their whatever, right? So make sure there's always reason why the baby is crying. So feeding infants, this is just a reminder for breastfeed babies. Feed the baby every 2 to 3 hours. For bottle fed babies, every 3 to 4 hours. And of course, if it's needed, right? If the baby is hungry. So bottle feeding safety as well. Make sure to prepare the formula carefully. Follow what's the doctor's order based on the formula. Uh, Refrigerate the formula only available for within 24 hours. And then after 24 hours, if the milk usually, if or the formula is not being taken by the baby, it should be discarded. That's what we usually do. And then make sure to warm bottles safely, right? Don't give a hot milk, don't give a very cold milk. It should always be in between. Okay? And make sure if it's a powdered milk, don't prepare the milk if the baby is not asking for it. Okay, so that it will not be wasted. Birthing the infant babies, of course, after milk, after meal, we always encourage for burping, right? Burping the infant babies swallow air during feedings, that's obviously. So when you need to always burp midway after feeding and support the head and neck. So when you cuddle the baby, you face the baby facing towards your arm or your chest, and then baby's facing your back, and that's how you let the baby burp, right? So that it's easier for them to burp. So that's always after feeding. And of course, when you're changing diapers, make sure you change diapers when it's wet and soiled, because we want to avoid rashes coming from the urine and from the poops. And make sure to document the stool patterns. What's this consistency, how does it look, what's the color, etc., right? So that you can report that to your supervisor if there's any unusualities. Of course, special report if the baby is constipated or even the baby is having diarrhea. The umbilical cord care, basically as a PSW, one thing that you just need to do is keep the cord clean and dry. Make sure that you will only observe for any complications if there's redness, you're bleeding, soaking, anything like that. Make sure that report that immediately, okay, to your supervisor. And then you fold the diaper below the stump. It should not be covered. It should always be below the stump. Just make sure to report, again, as what I mentioned, report redness or any ear drainage. So bathing for infants, use sponge bath until cord heals. So we don't really like wet the baby until the umbilical cord is healed, right? So for now, we just do sponge bath, maybe like a warm towel with in a baby's basin, and make sure you never leave your baby unattended, because we don't want them to be drowned, right? So follow the family routine, double check the care plan, how you do the bathing, The nail care and weighing, usually trim nails when baby's asleep. That's always the ideal. So you always use a proper baby nail cutter. If you are not confident and you are not trained to do it, don't do it. Also protect the infant from chills. So make sure if they're sleeping, cover them with their blanket and all that stuff, right? Always support the infant on scale. So make sure don't the nails too like you would call this too or something like that. Just a little bit clean, just the nails. Don't go towards the skin, because you might gonna the skin of the infant. All right. So that actually ends our chapter 41 for caring for infants and their parents. So if you guys have further questions, you can always go to your Elsevier, check chapter 41. There are more detailed discussions, or there are more detailed conversations in the book. So that's it for today. I'll see you again for the next chapter. Okay?